Jensen, and I'm a nurse and a senior lecturer at the School of Nursing in Holstebro. And I'm going to talk about a module at the School of Nursing in Holstebro. The students attend this module immediately before they do their final thesis. Our subject is nursing the socially vulnerable, and our main focus is caring for clients in the field of social psychiatry and abusers of drugs and alcohol. It's a tricky field, and some of our young students expressed that they feel either lack of experience or a lack of courage. Their concerns covers questions about their own safety, as well as the safety of the clients and the willingness to engage in the treatment and care offered by the students. Our aim during the module is to unfold the students' interpretations of the problems concerning medical issues that these groups face in daily life. And these groups, that is, the groups of drug and alcohol abusers, the homeless, and the mentally ill. So we introduce the students to this field by uncovering their personal competences and also the network they already possess but might not be aware of. This is the bird in hand thinking. What do they already know? And who do they already know? So the next gate is when the students realize that they actually already have some competences and relations to rely on. And then they begin to express their frustrations. Why is this situation so complicated when it comes to the patients or the clients or the citizens with social problems? They reject our offers to assist them. They are poor, they suffer from malnutrition, they have several diagnoses, and all of them are poorly treated and cared for, just to mention a few of the disharmonies the students discover in their practice. So how can we make a change? The students go through a transition where they develop their ideas from disharmonies to entrepreneurial possibilities. The importance of staying in the mode of divergence, keeping an open mind and creating all kinds of new and maybe imaginative ideas craves for some encouragement from us as their teachers. Some of the students seem to be in an awful hurry to close the subject after the first 2 or 3 ideas. Some of these ideas are not really what you may call a potential breakthrough or new at all. So we encourage them to come up with 100 ideas instead. And we place them on small posters. We push and discourage them a little bit by telling them that at least 100 ideas are what we want them to come up with in order to find the good and the brilliant and maybe even the perfect idea. The next case is choosing the best ideas for the students, which they have created, and now they are entering this process of convergence. At the end of this process, they pitch their ideas and present them to nurses with experience working with these patients and clients on a daily basis. So these are the nurses that really know what the problems are. And in the process, we are assisted by this small app developed by Incubator, and we are able to monitor the process during these 6 weeks that the module lasts. It is obvious from the beginning that the students feel insecure and may be puzzled about the structure and the goals of this module. They express doubts about their own skills and possibilities to make a difference to the socially vulnerable groups. So this ACT program shows that something happens to them during these 6 weeks. The students evaluate their own emotional, social and cognitive evolution by these 5 parameters: engagement, courage, competence, relations and freedom. As their teachers, we are able to follow or monitor this development. It means that we can engage into a dialogue with the students and adjust the process if things like, for example, here, where something happens, it seems that the courage and freedom to some extent collide with students. And later we can monitor that the students get the picture, so to speak, and feel altogether encouraged, engaged, courageous, competent, free, and in satisfying relationships. So that's nice. And evaluating the module after passing their tests, some students found that this tool was satisfying, but they thought that once a week would cover their needs for testing their own mode. In this case, we registered it twice a week. Some of the students suggested a possibility to make small remarks to help the teachers and the students themselves, remembering, for example, why this score of freedom in the second week dropped in such a dramatic way. We, the teachers, interpreted this drop as a sign of frustration due to the strict rules they could experience when caring for drug abusers in general. So maybe the students would feel pity for the abusers and therefore they felt powerless. On the other hand, we could also interpret that this structure of the schedule was too tight, so the students felt limited in pursuing their studies and their ideas. We never asked them that question, so we don't know. Earlier we had tried this ACT program during an interprofessional working module entering the second year of their education. And their score at that point was significantly lower. So of course it's too soon to conclude anything yet, but we think we can observe a tendency towards being in the grip at the end of the studies. And we have observed that several students pursued their ideas from this course in their bachelor projects. Yes.
Thank you very much.